here with Dr. Rustam, who is from Ukraine, and he's going to be telling us a bit about why he's here and what he does with his practice as well. So would you like to introduce yourself to everyone?
Thank you, Liz. My name is Rustam Zhurayev. I am head of the department private clinic, the Salutas Medical Center. We have 31 physicians and 4 practice nurses. We have 50 different patients a day and treat our patients, especially in primary care and secondary care. Thank you.
Yeah, brilliant. So obviously there's a big crisis in Ukraine right now, and I think it's affected, multiple layers of healthcare. How has that specifically affected your practice, and what are some of the challenges that you faced, and how have you overcome them?
During the war, when the war started in Ukraine, our healthcare systems faced with numerous challenges and problems. Especially, Russia destroyed 200 medical center in Ukraine, and also damaged 18 different centers also in Ukraine. And many healthcare workers come to safe regions such as Lviv, where I work, west part of Ukraine, and even abroad. And in my presentation in this forum, I focus on 3 themes. I speak about health care worker, how we work in this difficult time, and also opportunities and our future, because our future, I think, depends of our education. Mm-hmm. And this forum, participate in this forum is very important for us, because quality and safety, we must do this every day, even we live at work.
Mm-hmm. Yeah. In terms of the future then, when we're thinking forward the next 5-10 years, how do you think you'll be able to kind of cope with, looking forward to the future and looking at how the impact of the war is going to affect healthcare, and what are some of the things that you're kind of implementing now when you think about that lasting impact?
Yes, our future depends on our education. We provide in our healthcare system different, such as in your country, as NHS trust work, electronic system. Also, we treat our patient with European protocol. Also, our physician must, all our hospital must have quality and safety manager at our hospital. And I think when the war stopped in Ukraine, we go to European community and work as your country.
Yeah, definitely.
Yeah.
Okay. And last question then. What are some of the kind of stories, the personal stories that you've seen of doctors being really resilient in these times, specifically in your practice?
In my practice, many physicians who come to our clinic or stay in Lviv, because many of them lost the opportunity to treat their patient, and come here. We have electronic medical system, and all physicians can go to this database. Also, they communicate and have online consultation with patient. And for us, it's very important that this physician is at healthcare community, and even then lost her medical practice, they can do it online and at the another center. And we provide this possibility to this physician. Yeah. It's very important to stay with this patient and physician and help them at this difficult time.
Yeah. So you've really kind of rallied together the community to help each other out as well.
Yes, of course.
Okay, that's brilliant. Thank you so much.
Thank you.
Thank you. I'm going to be interviewing Dr. Yaroslav, so that's really exciting. Would you like to introduce yourself, tell us a bit about you and why you're here today?
Thank you, Louise. My name is Yaroslav Diakunchak. I'm a family physician. I have been practicing family medicine above 18 years. I work in Brovary Primary Healthcare Center, Kyiv region, Ukraine. So I'm very glad to be in this forum.
Mm-hmm. And so what are you going to be talking about today?
Today I, with my colleagues, will talk about the challenges for Ukrainian healthcare system, how to keep resilience during the time of the war. because more than 2 years Ukrainian people and especially Ukrainian Medical Society struggle with this awful Russian invasion of our country, protecting our dignity and freedom, faith and language and culture and history.
Yeah, so I know you've done so much to kind of keep up the quality in healthcare, but what I want to understand from you is, what do you do in terms of to cope with your personal stresses when you have so much to juggle, being the doctor you are?
Yes, despite the war, our family practice continue to work, delivering the evidence-based and patient-centered medical care. Especially providing medical care for elderly patients, also internally displaced persons, also for patients with mental health disorders, and also for patients with non-communicable diseases like cancer, hypertension, COPD, diabetes, etc.
And so what are some of the biggest challenges you face in trying to keep up that quality of healthcare for all of your patients?
So I think due to the high level of the stress during the war, we will have increased number of patients with mental health disorders. So we should be very aware about this and providing high quality care for people with mental health disorders.
So have you been doing kind of different trainings to help all the doctors to be able to cope with the influx of mental health patients?
Yes, sure. For example, we had the MH gap trainings by World Health Organizations, where we study how to manage with patients with depression, anxiety, PTSD, the prevention of suicide, etc.
So I guess the last question, what advice would you give to doctors who might find themselves in times of crisis and need to be able to continue to give the best quality for their patients?
First of all, I think it's very important to care about yourself, to care about your health, to care about your families, and improve your knowledge and skills, taking part in different trainings, have the communication with your colleagues, and keep resilience in this difficult time.
Okay, thank you so much.
Thank you, Louise, for your attention and for your interview.